Hey, everybody. Welcome back to the Beat Podcast. Saul Marquez here, recording live from the Vive event in Los Angeles. Today, I have the privilege of hosting Justin Dearborn on the podcast, CEO of Praia Health. Welcome to the podcast, Justin.
Thank you. Happy to be here.
So nice to have you here, Justin. Look, before we kick off the questions, I'd love to get a little more information about you and the work you do at Praia.
Great. Yeah, I was brought into Providence in August of last year with really the goal of spinning out Praia Health out of the digital innovation group at Providence. So this will be the fourth company they've spun out of Providence. And the way their model works typically is they identify a gap in the market, build a solution, deploy it internally at Providence, and measure the results there. And then they'll do some voice of customer work and determine, was this a Providence-only problem they solve for, or does it have commercial applicability? If they determine the latter, then they'll bring in somebody to finish the commercialization steps, which involves raising external funding, which we're finishing up that process right now. And prior to coming to Providence, I ran a patient engagement company for a few years, and then a digital healthcare startup before that, and then spent the majority of my time at a company called Merge Healthcare, which was a publicly traded medical imaging company that was acquired by IBM.
Yeah, for sure. Very familiar with Merge. And then in Praia, you want to tell us about Praia?
Yeah, Praia. Yeah, super exciting consumer engagement platform, and broadly would fall into a patient engagement, but there's a lot of noise in that space, and it's pretty broad, so you have to really define what that means. And what Providence recognized was missing, or they couldn't find in the market, was a platform to bring together all of the digital point solutions that they had invested in and rolled out in one fashion or another, but in not really a coordinated fashion. So patients were getting messages from sometimes different numbers, if it's text messaging, and they just weren't a coordinated reach. And this platform brings all of that together by starting with really ID as a foundation. So knowing who the patient is, and really actually starting before that, knowing who the consumer is, and through a logged-in experience, then we really can focus on an end-of-one personalization and leveraging all the investment they've made in things like their EMR, of course, as well as a lot of patient engagement solutions that they have deployed over the years.
Thank you for that. Yeah, that's super interesting. Sounds fine-tuned and certainly like a great solution. How do you see digital transformation shaping healthcare delivery in 2024? And what are the main challenges and opportunities this presents?
Good question. In healthcare, the challenges are always inertia and just there's a lot of things fighting for people's time on their schedule, and there's a lot of projects to be implemented, and healthcare moves slower. And there's good reasons for that in some cases. No one wants to be the first usually on a new solution. We have brokered that. So we have 2 customers, which is great, but it's hard getting the first one in healthcare. So inertia has a lot to play into it, tight staff. The opportunities are really endless, and you see that all the way from the big AI push, and that's driving a lot of discussion in the market. And really, what does that leads to automation? So a ton of opportunity there to really help health systems monetize and really capitalize on all the investments they've made in the past in a coherent fashion with something like Praia. And I feel like the timing is good for this. COVID was obviously incredibly difficult for people personally, businesses, and really it was tough to get attention for something that is a newer vertical. So we are evangelizing this. There's a couple providers in the space, vendors in the space, I should say, that are still evangelizing quite a bit. This is not an RFP sale. It's really going in understanding what gap a health system has on their consumer strategy and helping solve that puzzle piece. But it is a multi-department sale as well. It touches clinical, marketing, strategy. So a lot of folks involved, but there's lots of opportunities because it's still very early in the market adoption here.
Very interesting. And so you're leading the charge at Praia Health. What value does this company bring to healthcare?
Great question. So at Providence, the way they develop solutions, again, they recognize a gap in the market, build out, and then they have to generate an ROI to keep going with the investments. The ROI on this solution really depends on the use cases you enable. So a lot of it comes down to efficiency and self-scheduling, as well as expanding reach with a patient or consumer. So on average, in the U.S., adult sees 5 different providers a year. Most health systems might get 1 to 2 of those visits. So how do they keep more of that in the system? So even if it's not a clinical interaction, which a lot of folks are just really accustomed to just interacting with their health system or local hospital when they have a clinical need, how do they serve the holistic health and wellness? So about 80% of your health and wellness is outside of a clinical visit. So how does I'll use Providence in this case, Providence really provide a platform for that from things like wellness visits, In Providence's case, there's a lot of faith-based material. There's great literature. There's great other clinical things that you don't need during your visit, but just health and wellness documentation and information available to folks that a lot of people don't know it's available. Providence has libraries. Most health systems have a ton of information like that. So how does Providence serve the consumer and patient in a holistic way, either in between episodic care visits?
Yeah, that's a big opportunity. That's where most of the things happen. And so to be able to engage in those areas is key. What is the business value of shifting from patient identity to customer identity?
Yeah, so continuing with that theme, a lot of health systems and electronic medical records only recognize you when you become a patient, when you're scheduling a visit or you're scheduling a follow-up or looking at your lab work. Really, Providence took a holistic view and let's treat folks as consumers first. So we have multiple different ways to basically identify someone and log them in. So giving them a logged experience without a clinical experience. And really that, hopefully, there is some preventive care that can go into that and they don't become a patient in the end because that's really what the health systems are all about. But they can start as a consumer and you might evolve to become a patient, but you might not. But it starts that relationship at the consumer level versus a patient, which means you've already scheduled a visit in most cases, and the way most EMRs define it.
That's quite forward thinking on taking us toward that healthcare rather than sick care, as is commonly said. Some could see this as a competitor to the EMR. So EMR, friend or foe?
Great question. And one we get asked every time. So we feel we have a better together story. Providence is a big Epic shop, one of their larger customers, and has a great relationship with Epic and uses just about everything Epic releases. In this case, we feel like we are an enhancement to MyChart. So MyChart is part of the Praia experience. And Praia is white labeled, so you won't know Praia is powering the Providence app, for instance. But we pull through the relevant pieces of MyChart that a consumer or patient wants to see. And if you want to schedule a visit and you're in the hospital's using Epic for scheduling, you can punch through to that. So we're embedding MyChart within that experience, but then bringing the other non-clinical aspects to health and wellness around that. Providence, one of the metrics they track is MyChart adoption. And of course, there's fees for that. The more MyChart users, the more fees you pay. That's the way Epic and most software companies work. And they're happy because the ROI on a MyChart user goes off the charts, not to use a pun, but so they're happy to pay for that. We're actually helping with we're taking a little friction out of that adoption, and they've measured 17% additional MyChart adoption using Praia. Good for Epic, good for the health system, good for patients, good for us. So we do think it's a better together story. But Epic does obviously provide some of these things. But again, we look at the entire health and wellness picture.
Appreciate that response. How's the organization working to ensure that advancements in healthcare technology are accessible and equitable, particularly for underserved or rural communities?
So just like all the push for infrastructure improvements for rural areas, I think that really took off during COVID. One of the positives maybe that came out of that was telehealth and all the services that go around that. The adoption of digital health, I think, is proven. There's lots of different metrics for that, but to help underserved communities, whether they're transportation challenged, they don't live near a hospital. So I think just the adoption, and we're helping focus and streamline the delivery of those digital tools. I think most people would say that digital adoption does benefit folks who traditionally weren't part of the health system and hopefully can help with some preventive care. And part of our ecosystem strategy, we're bringing on there's some really cool companies that I will save for our press release coming up, but that do really cool stuff like food delivery, transportation, work with underserved communities. They'll come in and build a ramp for someone who needs that service and outfit your house for someone who's become disabled. So really cool services that, again, we'll serve up through the app. And frankly, I didn't know some of those things were available, and I think a lot of people didn't. Broader availability of those, I think, is beneficial for everybody.
Well, you guys are definitely doing a fantastic job, Justin, with inclusion as well as helping people stay healthy. Really excited about what you guys have going on with Praia and the work that you'll do moving forward. Thanks for being on. And if you were to leave the listeners with a closing thought, what would you leave them with?
Wow. Good question. I think healthcare moves slowly, but it feels like we're at a really interesting inflection point with AI is going to drive a lot of it and for the better in healthcare. There's a lot of talk about, of course, AI and good or bad, but I think in healthcare, it's really positive. And most The vast majority of folks who are in this space are really doing it for all the good reasons. So I think it's being applied for the benefit of everyone. And it really, an overused term, but it really is democratizing healthcare and all the digital solutions that are available to folks who never had access. There's a lot of cool stuff happening, and it's happening fast.
Yeah, it certainly is. And Justin, just want to say thanks for being with us today. It's been a pleasure.
Thank you.